everyone. I just have a couple quick things to mention, a little kind of a COVID update as COVID is starting to definitely rise again around here. Things are getting a little busy, so we'll start sending out more COVID updates about what's going on. But one thing I wanted to let you know, we have received in a large shipment of some N95 masks. This is the Honeywell N95 mask. And then this one is BHD. So you've probably seen, most of you have probably kind of fit tested for one of these. If you wear a regular size of the ProGear N95, you definitely need to test for one of these because the regular ProGear duckbill masks are going to be going away. And we have lots of these. If you wear the small duckbill N95, still please try to get tested for one of these because we have a lot more of these than we do of the ProGear. And so we have several people in the unit who can help you with fit testing, so just kind of ask around. However, we have enough of these now that we're changing our practice, and so first, we should be wearing now an N95 mask in our COVID positive patient rooms all the time. So not just for aerosol generating procedures, but anytime we go into a COVID or a PUI room, we can wear the N95 mask all the time. And now they want for us to be doing still extended use, but you don't have to be reusing the mask. So if you can wear one mask all day, then at the end of the day you can discard that mask and get a new mask the next shift that you're working. So one N95 mask if you're working with COVID or PUI patients all day long, and then you can just discard it. So because we're going to be going through these a little bit more frequently, we wanted them to be available a little bit more, and they are up in ICU. Both of these types of masks have been stocked in the cupboard by where the charge nurse sits. So down to the left of where the charge nurse sits, we have boxes of these two N95 masks. We still don't want to put them in the stock room because we do feel there's still potential that somebody coming through who's not really as much into healthcare, I'm not sure, could walk away with a box of it. So we don't want to just kind of leave them out en masse in boxes on the shelves, but they are stocked down there, so you can just go and take one and you don't need to sign it out. If you use the ProGear small mask and one of these other ones doesn't work for you, we still have to keep those ones locked up because we have very few of those. So that's the deal with the masks. Also, starting today, we have restarted our COVID testing on every patient coming in through the ER. When we started it a while back, we had problems with it and they had to suspend it because they were getting a lot of false positive tests. So they feel that they have fixed that problem, and so you will start to see patients coming through the ER with that COVID admission test again. And just a reminder, the test doesn't mean that the patient necessarily has to be put on precautions. It's only if the test is accompanied by symptoms and the physician or provider deems that the patient is having COVID symptoms. Then we have to put them on as a PUI while we wait for the result. If they are asymptomatic, then they just go into a regular room, no precautions. And then the last thing I wanted to mention is that Wednesday is the last day for our dysrhythmia test, so just make sure that you stop by for that. And that is all that I have. Thanks everyone. Have a great day.